Earlobe sewn to face after facelift neck surgery. Surgeon states nothing can be done. Seeking other opinions. 14 weeks ago, I had a platysmoplasty facelift in South Florida by a 20-year-old board-certified surgeon to fix prominent vertical neck bands. Happy with my neck, I didn't expect to see my unattached earlobes repositioned and sewn to my face. At my 2-month visit, I reported painful popping, pulling of ears, swelling, numbness, restricted jawline and neck, making it dangerous when driving. Unhappy with my ear changes, my doctor suggested I was unappreciative of being made pretty. Need a new doctor.
Thank you for your question. It's about 14 weeks since your surgery, and you've submitted a very detailed series of photos of your ear after you've undergone facelift and platysmoplasty surgery, as you described, performed by a 20-year experienced board-certified plastic surgeon. And you stated that you were concerned about some pulling and some pain and numbness involving your ears, and you described how your earlobe was detached and now it appears attached. And of course, you also mentioned in your question that you and your doctor have had a disagreement about the perception of this issue, and so now you're looking for additional opinions. I can certainly give you some perspective. I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and a fellowship-trained oculofacial plastic surgeon, practicing for more than 20 years in Manhattan and Long Island. Eyelid surgery and facelifting and neck lifting surgery is a big part of my practice, and I can certainly give you my perspective on how we deal with patients who have this type of an issue. To begin with, what you're describing is often referred to as a Pixie Ear deformity. It's not the most flattering terminology, but basically it happens when an earlobe that is rounded and detached becomes attached and then pulled downward. Now, there are a variety of reasons that this can occur, and certainly since no one reviewing this question can state exactly what happened during your surgery, but there are a couple of ways to approach this. It's a matter of really just making the right choice between these two options. Sometimes when the Pixie ear deformity occurs, it is because there is some tension on the earlobe that is causing the skin to pull in downward, and the earlobe is being dragged along with it. Now, that can be interpreted as a skin shortage, but it may be that that's the situation, at which point it is probably advisable to allow a little bit of time for the maximum pull to finally dissipate. You know, this is still 14 weeks after surgery, and there is a lot of dynamic changes. Usually, if it's tolerable and there's no urgent issue, we try to wait for anywhere from 3 to 6 months after a patient has had surgery to address this issue. Now, if there is enough skin, and if there is other issues, then what we would do is actually elevate the skin to restore that connection in a way that so that the skin doesn't drag down and that the earlobe can be reset. More commonly, when I see patients in consultation with a Pixie ear issue, there's usually a skin shortage, so there is no room to pull upward any further. In those situations, we actually just detach the earlobe, roll it under to recreate that detached earlobe look, and then we close that area underneath so that the skin to skin and the earlobe can be seen nicely and defined, and that is something that is relatively straightforward. So it might be that your doctor with your ongoing visits may decide to agree with you and go ahead and do this. If you're satisfied with the rest of your facial cosmetic procedure, then it would be a shame to have let this sour your experience with your doctor. So you may want to give your doctor another chance at resolving this, because I think that most doctors who perform facelifting surgery will understand what to do, whether or not they were responsible for the creation of this situation. But this is just something where the answer is simply yes, something can be done. It's a matter of deciding which option. Do you need the face to be lifted further and the dynamics to be changed, which is less common, and more commonly is to do something that's more local at the level of the earlobe that can restore the shape and complete the results so that you're satisfied with the final outcome. So I think to answer your question, something can be done, but I would suggest that you just try to talk to your doctor again. A lot of surgeons don't always have the best interpersonal skills, so it's probably worth just giving them another chance to see if you can have your original doctor who knows your skin, knows your situation, and if they're willing to do it, then that's probably who you should really go to, instead of just abandoning all hope at 14 weeks. I think that if you feel that there's too much friction and ill will, or if your surgeon is still determined not to acknowledge that there is a significant change that can be managed, then of course, meeting with other doctors to resolve this is going to be necessary. So I hope that was helpful. I wish you the best of luck. Thank you for your question.